Hey everybody, I'm your four-eyed professor, Chris Levens, and I'm super excited to talk to you today. Our roll call is for new and experienced ODs, optometry students, and even those just interested in this profession. We'll cover a number of topics together, and I'll help you see them through a professor's eyes. Please take your seats. School's in session. Welcome back, everybody. Thanks for joining us today on the Four-Eyed Professor podcast. I'm Chris Levens, and glad to have you in attendance. We have a new topic for today, something that we've not talked about before, and the reason is because it's brand new. And so I'm going to bring on screen with me Dr. Rudrani Banik. So welcome. Nice to have you. Nice to see you again.
Thank you so much. Thanks so much, Dr. Levens, for having me on.
Hey, my pleasure. So before we dive into what this Eye Health Summit is all about, because it's coming up soon, please tell the audience about you, about yourself.
Sure. So first of all, thanks for having me on your show again. I'm an ophthalmologist. I'm a board certified ophthalmologist, and I'm also a fellowship trained neuro-ophthalmologist. And I'm based in New York City. I have a private practice, but I also have an academic appointment at Mount Sinai. So New York Eye and Ear Infirmary of Mount Sinai. Maybe some of you have heard of it. It's one of the oldest eye hospitals in the country, if not the oldest, I think. And I love to educate. So I do a lot of teaching at the hospital. I run some clinical trials in neuro-ophthalmology. So I have a really nice balance of a private practice, but also the academic side.
Yeah, you really do. It's arguably one of the most famous eye hospitals in the world. So do you live in the city?
I do. I live right in the heart of Manhattan, and I love it.
Wow. The city that never sleeps.
It's true. Sometimes I happen to be up really late and I look out the window and the road, I can see the avenues are still jam packed with cars and Ubers and taxis. Yeah.
Yeah, totally true. Well, the Eye Health Summit, what is this? How did it come about? And what can people expect when they attend?
Sure. Well, the Eye Health Summit is the first of its kind, as you were mentioning. It's never been done before. And this is a project I've been dreaming of for the past, I would say, 6 or 7 years or so. And the goal is to get curated information out to the public on what they can do to prevent eye disease. Now, most people don't even know, first of all, that they should be going to see their eye doctor once a year after the age of 40. Most people even don't know that. They don't think twice about their vision until something goes wrong. But we know as eye doctors that there's so much people can do proactively to prevent conditions. And also, if they have been diagnosed with a condition, what they can do to manage it to their best of their ability. And unfortunately, when people do go to the eye doctor, they only get, a short period of time face-to-face with their doctor, maybe 10, 15 minutes if they're lucky. They get to ask their questions, get some information. But the Eye Health Summit is really designed to be a resource for patients to learn about eye disease and refer back to it. And so I've invited, I'm the host of the Eye Health Summit. I've invited 35 eye care experts, including yourself, Dr. Levens. So thank you for being one of our speakers on the summit. You contributed a lot when it comes to contact lens care. But each of the speakers is talking about a particular topic and their areas of expertise, and they're sharing their insights into it. And so I'm interviewing them. We, have a nice conversation back and forth. It's kind of like a podcast. It's pre-recorded. Each interview is about 30, 35 minutes. And we cover a whole range of topics from common things like dry eye, ocular surface disease, to refractive errors, presbyopia, AMD, cataracts, glaucoma, and then some topics that maybe people aren't so knowledgeable about, even as eye care doctors. For example, ergonomics. What are some ways to really prevent eye strain at the computer? How should we position our screens? How should we be sitting? So I have a physical therapist talking about optimizing your ergonomics. I have sessions on ocular nutrition. So I'm one of my passions is nutrition. So I have a session where someone's interviewing me about ocular nutrition. We have lifestyle. So we have a couple of integrative optometrists and holistic optometrists talking about those topics. We have a topic on homeopathy for eye health. Acupuncture and traditional Chinese medicine for eye health, functional medicine for eye health. So we have the common topics, but maybe also topics patients and providers may not have heard about. And yes, it is patient facing, but I also encourage providers to join because again, there's such a wide range and we can all learn. I've learned so much from my experts in interviewing them in this process. It's really a great platform to spread education, really.
I love it. And this is absolutely needed, and it's especially unique. So how does one go about attending?
Yeah, so it's really simple. Number one, it's free. I don't know if I mentioned it's free. So anyone can join if they have an internet connection. You can go to our website, theeyehealthsummit.com, and you can register there. And I've been, promoting this widespread, like media interviews, TV, podcast. Right. So hopefully we'll get the word out. But also, if you're a provider and you're tuning into this, please share it with your patients. It's so simple. They just need to go to the website, log in, join, and then they'll get it's being released during Healthy Vision Month. So we're very strategic with this, my team and I. So Healthy Vision Month happens to be in May this year. And so the summit is running May 1st through May 7th. And the way it works is once you register, you will be getting emails to notify you, okay, when are the talks being released? Every day we have about 4 or 5 talks that are released. So you'll see the topics ahead of time. You'll see who's speaking. You'll see the agenda. And then those talks will be available for 24 hours. Mm-hmm. And then those talks will expire. And then the next set of talks will be visible and be accessible. So basically, it's kind of a stepwise progression. Every day, new talks come up, but the previous talks expire. And the other good thing about the summit is that it is hybrid, meaning that we have all the interviews are pre-recorded, but there are live sessions also. So I've invited many of the speakers as well as some other panelists to come and take some questions from the audience in their areas of expertise. So there's a dual component here. There's the pre-recorded, which is kind of do it on your own time frame, self-paced. But then there is the live version that will take place at 6 p.m. Eastern, 3 p.m. Pacific every day during the summit.
Yeah, fantastic. So as you look into the future, where do you see the Eye Health Summit going?
I have big plans for this. Again, I want to reach as many people in the world. And, based on the speakers that we have for this year's summit, many of them are US based, but some are also international. We have other countries represented also. So I want to get this information out there. And I hope that the summit will grow. Hopefully it does well the first year and we're able to continue doing it. We hope that we will continue to make this an annual event. And I do want it to become the eye health event of the year where patients will say, oh, I should tune in to learn about XYZ diagnosis that I've been diagnosed with, or maybe, my parent has this diagnosis, or my child has been diagnosed with this. Mm-hmm. We also have a couple of pediatric ophthalmologists who are experts, and we talk about double vision and eye strain and all kinds of things. So anyone can learn, anyone can join. It really has topics that are applicable, especially screen time. We have a couple of talks on blue light, management of screen time, eye strain, presbyopia, et cetera. So again, there's something for everyone. And I do hope that the way that we can get it to grow and to really become like the premier eye health event of the year is for all of us as eye care providers to share it with our patients. And so again, if you're listening, please share it. And I do want to add something else. I'm assuming that most people who are listening are optometrists. Is that correct? Or optometry students. Right. There is, so I do want to share this kind of the behind the scenes the Eye Health Summit. So on the surface, it's free. It's a free summit. Anyone can join, anyone can learn, but the talks expire. So let's say you missed a talk and you really wanted to hear it. You really wanted to hear that speaker. You can then purchase the summit. So on the back end, there is an option to purchase the summit package, which includes recordings of all the talks, the audio. So if you want to listen to it like a podcast, you can do that, the transcripts, and there'll be a lot of bonus material. So you can purchase the summit. But beyond that, as eye care providers, there is a way to earn revenue. You can earn revenue by being a partner in the summit. So if you want to join, I can provide you with an affiliate link. You can be an affiliate for the Eye Care Summit. Share it with your audience, your patients. If you're on social media, share it with your link. When people join with your link, you will get credit for them joining. And if they purchase the summit, you will receive a percentage of the commissions, from 40 to 50% of the commissions of the sale. You can earn revenue. So this is a nice way for people who are sharing this with their patients to also benefit in income. It's a potential revenue stream as well for us as eye care providers.
So yeah, another fantastic idea and pretty novel. Is it time zone agnostic? In other words, if somebody's going from the opposite side of the planet as the United States, can they attend and get the 5 presentations per day approximately as they like?
Absolutely. So we're releasing all the new talks at 9 a.m. Eastern. So that means 6 a.m. Pacific. And those talks will be available for a full 24 hours.
Got it.
So anyone can join. Again, anywhere in the world, anyone can join, because hopefully they'll find a time during their day to listen to those talks. And again, if they don't have time or they missed it, they can purchase the summit. So that's an additional option. And the live sessions, that's the only aspect of it that's not time agnostic is the live session. We try to time it so that people would be out of work or finishing up work if you're working, so that you could join the live session. And they will be recorded. So again, people who have the full access pass will have access to the recordings of the live sessions.
Got it. And what's the approximate time commitment? So in other words, if I want to hit all 5 approximately every single day, about how long am I going to be in attendance?
I would say, so most of the talks are between like 30 to 35 minutes long.
Okay.
So if you allot about 2 hours, 2.5 hours, and some talks are like, there are a few topics that are a little bit longer, like 40 minutes is kind of the max, but 2.5 hours should be plenty of time to listen in on the talks. And also a quick tip is I also listen to a lot of summits or their podcasts as well. So I just do like 1.5 speed or 2 times speed. Like if I'm, if I'm kind of familiar with the topic, I'll just listen to it faster. And that way you can get through it at a much faster speed or faster pace.
Are the topics bookmarks? In other words, if I want to skip dry eye but go to glaucoma, can I hit that?
Absolutely. Yeah. So we have a portal for the summit. So you'll have your own unique login. You go into the portal, you see each day's sessions, what's available, what's live, what's released, and then you can pick and choose. You don't have to do all of it. If you want to listen to only one, go ahead, be my guest, listen to only one talk. But, what I've learned in doing these interviews with my guests is that they have so much to share. And you may think, I know everything I need to know about cataracts, or I know everything I need to know about blepharitis. But that one expert may share something that you're like, wow, I never realized that. I'm going to incorporate that into my patient care. So even though you may think that, oh, this is a topic I don't really need to know about, there's something in each talk that is just like little nuggets of gold that really people can benefit from.
Timing wise, are you targeting this same month that's focused on eyes to do the Eye Health Summit annually?
I think so. Again, this has been a huge endeavor. This is our first time doing it. So we'll see how it goes. I think timing wise, it works well because it's not summer. People are kind of tuned out during the summer, at least in the Northeast. And we didn't want to do it too close to the holidays because that's a very busy time as well. So we thought the spring would be a good time. We'll see how it goes. But as of now, probably it will still be May every year. And hopefully we continue it. That's what I'm really, and, we have sponsors. So we have a couple of, I don't want to say their names yet. We're still finalizing the contracts, but we have some industry sponsors in the eye care space. And also, I didn't mention this earlier. We wanted people to be engaged during the summit. We wanted to be participatory. So yes, you don't want to feel like you're doing this in a vacuum and everything. That's why we have the live sessions, but we also have, it's gamified. So basically when you watch a session, you can collect points. So you check it off, like I watched it, I did whatever the activity is related to the session. It's a quick activity. You check it off, you get points. You get points every day as you're going through the summit. And then at the end, or actually at the end of every day also, we will have prizes and giveaways. So you can win various prizes. So we're going to be announcing those probably in about 2 weeks. So we have about a month left before the summit will air, a little less than a month now, but we'll be announcing all those prizes and giveaways. So it is, it's really designed to encourage people to participate, that it's not boring. It's not a webinar that you're watching. We want people to learn and have fun when they're learning as well.
I love it. All right. So before we close out, 2 things. One, I'd like you to share something that surprised you about all these interviews that you've done, something that's front of mind that either inspired you, excited you, something that you didn't know, some nugget that people will learn by attending the Eye Health Summit. And then remind us all the website, because I want everyone in audience today, as soon as this podcast closes, to go right to your internet browser, log in, and register.
Yeah, so I learned something from each of my guests, but I'll just highlight 2 of the topics that may be applicable here. One would be my speaker on refractive surgery. So he talked about all of the different types, the history of refractive surgery, and like how all of these various procedures came about. And the latest one, which is EVO ICL, which I have no financial interest in, but I learned so much from that, because now, I don't do refractive surgery myself. I've never had it done on myself. But when patients ask, because patients always ask us, you can provide them with the latest tips. And the second thing I found was so interesting was the talk on, I believe he calls himself an integrative optometrist, Dr. Mark Grossman. You may have heard of him before, but he does a lot of education on acupuncture and traditional Chinese medicine. And he was talking about how he uses herbs in his practice, traditional Chinese medicine herbs, in conjunction with the traditional things that we always use in our, that we're taught in school. So it's not exclusive that he doesn't only practice traditional Chinese medicine. He combines it with the conventional methods. But I found that so interesting. And he's been doing this for like 30 plus years. And he's practicing in upstate New York. It was just so interesting to know that there are providers out there using some of these, I wouldn't say alternative, because they're not in place of traditional approaches. They're complementary. We can say that they're complementary approaches to eye health. So I think those are some really interesting talks to tune into as an eye care provider that I would want to learn about. Like, okay, my patients may ask me about this. I have no idea about it, but I can educate myself and learn about, so I can speak about it a little bit and then guide patients better when they ask about it.
Perfect. All right. So call to action.
Yes. And so the website is theeyehealthsummit.com. There is another eye health summit out there. It's not quite patient facing. It's kind of a slightly different goal. But theeyehealthsummit.com. And
everybody register.
Please register, please, please, please. And, we're going to be promoting it on social media. So if you want to be an affiliate, please register. If you, I do a lot on Instagram. So if anyone's on Instagram and you want to be an affiliate, I'm happy to do an Instagram live for your audience. And we can talk about the Eye Health Summit just like we're doing right now and get people to register. And again, they would use your link to register, so you would get credit for it. It's really an interesting business model. And I'm excited. I'm really excited to get this information out there to the world.
Me too. Can't wait.
And
Thanks
thank you
for sharing such a novel concept. I mean, and taking the reins on this enormous project and actually coming to fruition here in a matter of days.
Yes, it has been an enormous project. I mean, I had the concept like years ago, but I actually started working on it about 6 months ago. It takes a long time. It takes a long time to coordinate all the speakers, 35 speakers, all the topics, package it up nicely, do the promotional part of it, which is what we're right in. We're in the midst of the promotional mode. So it's fun. I find that, this is like a creative outlet for me. I really enjoy it. There's patient care as well, but this is like exploring my creative side. Like, how can I get this information across where people are going to want to learn and remember and enjoy the experience? So it's kind of like a little challenge as well. But
perfect. Yeah. Thank you for sharing all this with us today. I really can't wait for it. I'm going to be in attendance, and thank you for really delivering something special. So everybody, do as we said, go register right now, the eyehealthsummit.com. Thanks everybody for attending.
Class has ended for today, and we have no exams or grades approaching.
Please email me at foureyeedprofessor@gmail.com if there are topics that you would like to hear and see through a professor's eyes.